Hi, everyone, and welcome to today's community presentation. My name is Jeong Lee, President of Asian American Resource and Information Network. I served for the study as Community Principal Investigator. The title of the study is Understanding Community-Based Organizations' Capacity to Serve Older AA and NHPI, Asian American and Native Hawaiian and Pacific Islander others during the COVID-19 pandemic. From the study development to the data analysis, our research team worked very closely under Dr. Linda Ko's leadership. So you are seeing our research team right now. Today, we will cover the study's background and aim, survey and interview results, and recommendation from the study. And the Q&A session is coming at the end of the presentation. During the presentation, please use the chat box for any questions or comments. Then we will address your questions during the Q&A session. Now, I would like to introduce Dr. Linda Ko, our academic principal investigator of the study. Dr. Ko is Associate Professor of Health System and Population Health of University of Washington, as well as affiliated researcher at the Fred Hutchinson Cancer Research Center. Dr. Ko will provide us with brief background information for the study. Dr. Ko, it's your time.
Sure, thank you, Jeong. Good afternoon, everyone, or good morning if you are in a different time zone. I would like to provide some background information to set the stage for this project. As we all know, the COVID-19 had a devastating impact in the US and globally. In the absence of an effective vaccine for COVID-19, public health measures consisted of isolation, quarantine, and social distancing in 2020. While these strategies lower the risk for exposure, they also pose challenges, especially for older Asian American, Native Hawaiian and Pacific Islanders, or AA and NHPI adults, because they experience isolation, language barriers to accessing health information, and were unable to network with culturally relevant groups. And we have also seen the increase in racism and hate crimes against Asians since the pandemic, posing another layer of complexity for older AA and NHPI adults. Next slide, please. But we also know that community-based organizations, or CBOs, are key settings for providing social services, community health education, and connecting community members with resources. And CBOs they also have to redirect their services to meet the needs of their clients with health insurance assistance, providing rental assistance, and transitioning their services to be delivered online during the pandemic. CBOs that serve older AA and NHPI adults were particularly vulnerable to all of these changes, as many are small CBOs and highly dependent on support from volunteers. So this project aims to understand the CBO's current capacity to sustain their organizations, as well as needs for future programs to improve health and well-being of older AA and NHPI adults. Next slide, please. So we had two major aims and sub-aims under each of them. The first aim was to conduct a survey to determine community-based organizations' capacity to serve older AA and NHPI adults since COVID-19 pandemic, identify programs that address older adults' needs, but were rolled back due to the pandemic, and community-based organization resource needs to continue to serve older adults during and after the pandemic. The second aim was qualitative, using semi-structured interviews to explore how the COVID-19 pandemic has impacted CBO's operations, sustained and mitigation plan, and how older adults coped with social isolation, access to culturally tailored health information, and barriers to technology use. Next slide, please. I wanted to describe a little bit about the study, which reached out to community-based organization and asked two people from each CBO to participate, one person from the leadership and one person from direct services across the US. We're hearing some background noise. If you could mute your mic, that would be great. I think it's helpful for others. The data collection took place from from January through April of 2021. Our goal was to survey 100 CBOs and conduct 30 interviews with those who participated in the study. And we had 65 survey participants and 37 interviews. And just like any survey, we had some missing values, but we have mostly complete data set on 61 participants. Next slide, please. In terms of study workflow, we used a mixed methodology of quantitative and qualitative research methods. And this is a graphic representation of our study where we conducted the survey. Then we conducted some preliminary analysis to understand our data. Then participants were asked to self-select themselves because if they wanted to participate in the semi-structured interviews, then we contacted those participants who volunteered to be interviewed, and we analyzed the data, and we are currently integrating both the survey and the semi-structured data for data interpretation. Next slide, please. Now I'm going to pass the slides to Dr. Eunjung Lee, who will be presenting the results of the survey.
Thank you, Linda. Okay, next slide. I want to start presenting who the survey participants were. So as you see this table, 75% of women were participating in the study, and 75% of the participants, they were speaking another language besides English, and 58% of them were foreign born. And when we asked them which year they entered to the US, it ranged from actually 1965 to 2015. So I believe that many of you are remembering that 1965, the year of Immigration and Nationality Act, became. So it was the has been a long time to accept Asian immigrants to the United States. I was very surprised when I saw 1965 and as entered years. So average and residency years range from 6 years to 56 years with an average of 28 years of US residency. And 89% of them were college graduate and above. And their average age was 48 years old with a range from 24 years to 76 years old. Among the participants, 56% of them were holding leadership position at their current community-based organizations. Their work years at the current CBOs were widely ranged from 3 months to 28 years, and it was average 9 years of experience at the current CBO. 61% of them are directly interacting with clients more than 50% of their time at work. As you see the graph on the right for the participants' racial and ethnic background, the Chinese were 33%, followed by Korean with 22%, and Japanese 14%, Vietnamese with 6%. Next slide. You see the map right now. Participants from West region were the most with 50% in the study, followed by 26% Northeast and 17% of Midwest. There were a small number of participants from Southeast and Southwest. We tried to contact and reach out to the community-based organization in the Southeast and Southwest regions, but we did not have that many responses during the data collection period. Next slide. Next slide shows organizational profile. To avoid duplicated organizational information, we used one data, especially leadership data if possible, per organization here. When we asked the year the organization was established, it surprisingly varied from 1898 to 2015 with an average organizational age of 38 years. 40% of leaders self-identify their organizations as community centers, and 53% of them as social service providers. And when we asked the workforce situation with full-time, part-time, and volunteers before the pandemic, it also showed a wide range from 0 to 300 full-time and 0 to 500 part-time and volunteers. The average number of full-time staff by organization was 41, 33 for part-time, and 73 for volunteers. For the organizational budget, 48% were below $1 billion and 8% below between $1 to $3 billion. 11% of organizations were $3 to $5 million, and 33% of organizations had 5 million and more. You see the racial and ethnic subgroup graph the organizations are serving on the right. As you see, 12% of organizations are serving Chinese, followed by Korean, Vietnamese, Japanese, Filipino, and Southeast Asian, Native Hawaiian and Pacific Islander. I think this graph shows most organizations we in the study served many diverse ethnic groups among AA and NHPI. Next slide. Now I'm going to cover the impact of COVID-19 on organizations. Next slide. I believe all of you remember the most communities and states started lockdown and social distancing policies in mid-March 2020. So this table shows what the immediate impact on the organizations were. 80% of participants experienced increasing demand for existing services, and 75% of them experienced need for new services. And at the same time, the 69% of respondents expressed disruption of providing services and programs to their clients. And 55% of them had staffing challenges, and 38% of them expressed their organization had to temporarily close. Next slide. Next slide shows how CBOs responded to the pandemic. As we all guessing, 88% of participants identified increased online presence. And it means some of the programs and services and even fundraising events were delivered online. Surprisingly, 52% of participants shared new employee hiring, and a few organizations had layoff, follow, or hiring freeze. I think as we just saw in the previous slide, with the increased demand for new services, I believe some organizations seem to hire new staff rather than reducing staffing. 20% of participants expressed the organization used their financial reserves. Among the participants, 64% of them had a hybrid work arrangement, and 15% of them fully worked from home, and 52% of them shared decreased volunteer workforce. Next slide. Okay, now we are going to talk about the impact of COVID-19 on organizational revenue and expenditure. 34% of organizations experienced revenue losses. 70% expressed unexpected expenditure during the pandemic, and 79% of organizations received additional funds. So we asked the sources of the additional fund. 46% came from other nonprofit or foundations, and 45% from federal government, and 38% from state government, and 17% from organizational fundraising events. Next slide. So The next question was how they used additional fund. So 54% of organizations used the additional fund for their day-to-day operation, 49% used for expanding programs and services, and 34% used for technology or technological training. Next slide. So we also explored any changes of needs and services to serve all the others. So next two slides will show the changes. First, 33% of participants stopped to congregate meals entirely. At the same time, home delivery meal service increased among 31% of participants. 38% of respondents introduced caregiver support as a new service during the pandemic. Next slide. Another significant increase was increased mental health counseling among 44% of respondents. At the same time, 28% of respondents expressed a reduction in transportation service. 62% of participants shared they increased social service and referrals. Next slide, yeah. As we discussed during the result discussion, 88% of participants, they expressed the increase in online presence. So we asked how much all the others are comfortable or accessible to use technology or internet. Our exact question was to the best of your knowledge, what percentage of total all the clients have internet access, are comfortable using the internet, have tablet, have a smartphone, or have a computer. These numbers might not be accurate since we asked CBO staff members. However, it still shows that many older AA and NHPI others show low comfort level in using the internet, and only half of them have internet access. Okay, now we will present interview results. As Dr. Ko mentioned in the beginning, we were hoping to explore deeper insight to serve all the AA and NHPI others from interviews. So Ms. KeliAnne Hara-Hubbard will discuss our interview result. KeliAnne served as graduate research assistant for the study, and after graduating her master's program in public health, this May, she is working at the University of Washington's Health Promotion Research Center as a research coordinator. Her main role is to increase the vaccination rate among people of color, immigrants, and underserved communities. So KeliAnne, it's your time.
Thank you, Jeong. And just as a reminder, since it's been a little while, for these interview results, there were really sort of two aims that we were focusing on. So the first is understanding and really exploring how the COVID-19 pandemic impacted CBO's operations, their sustainment, and your own sort of mitigation plans. And the second was to explore how older Asian Americans and older Native Hawaiians and Pacific Islanders were coping with various challenges regarding the COVID-19 pandemic. So including social isolation, access to culturally relevant health information, and adjusting to barriers with technology use. And we are currently in the process of doing sort of a deeper dive on all of the interviews, but we wanted to share with you some of the preliminary results today. So there are 4 themes, or really kind of 5 themes that I'm going to focus on. The first is organizational resourcefulness to acquire and share critical resources. And this really speaks to that first aim of the impact of COVID-19 and how organizations really came together and responded to continue being able to operate and offer very crucial services to our community. The second theme is technology as a connector for organizations and also, unfortunately, as an isolator for older adults. So you can see how this theme really addresses both aims, speaking to the impact of COVID-19 and the need to shift to technology, but also how that subsequent challenge became an issue for some older adults. The third theme we will discuss is heightened racial discrimination during COVID-19, which really talks to how CBOs were already oftentimes addressing this issue, but continued or expanded services around racial discrimination, and also how this impacted our participants and our older adults on an individual level. And the fourth and sort of fifth theme is the emergence of personal and organizational and community resilience. And we'll talk about those sort of separately, but really starting to think about just the strength and immense hope and positivity that we saw from many of these interviews despite all of these challenges. So starting first with organizational resourcefulness to acquire and share critical resources. As Jeong just mentioned, there were many financial and operational hardships that organizations were living through and continue to live through with this pandemic. But what we saw oftentimes with these interviews is that some of the most powerful resources that these organizations had were among their personal and professional relationships and their ability to innovate, their creativity and adaptability, their ability to respond during such a crisis. So through these personal and professional relationships, there were quite a few different ways in which these relationships really helped organizations thrive. This included items like donations. So from individuals or even small businesses, donations for meals, for PPE, even donations of expertise, such as bankers reaching out to help organizations apply for their PPP loans. It also included collaborations with other organizations, even coalitions, through information and expertise sharing. So this might include exchanging, utilizing of resources like facilities or webinars, providing referrals to another organization, or even cross-marketing another organization's events, and ultimately working in collaborations to exchange crucial COVID-19 information, procedures that were relevant or affected by COVID-19, or even some of the racial discrimination work as well. The other piece that we saw was just this immense creativity coming from so many organizations around shifting services. So identifying both what were the changing needs of older Asian Americans or older Native Hawaiians and Pacific Islanders, and then addressing those needs. So as Jeong mentioned, items like expanding meal delivery services, or in some cases, these organizations previously didn't even offer meal delivery services, but began to because they saw a need in the community. This also included other services like rental assistance, legal assistance, racial discrimination and support, and many other services as well. So really an amazing feat of flexibility and strength and resourcefulness to address all of the issues that were coming up. The second theme is technology as a connector for organizations and an isolator for older adults. And this may not necessarily come as a surprise to many, but what we heard oftentimes from individuals at the organizations was that technology was really a necessity for CBOs to be able to respond and to be able to continue working throughout the pandemic. Now, unfortunately, with the shift to technology, this also increased isolation for older adults. And there was a bit of a dichotomy where organizations were hoping to increase safety and wanting to protect both the elders that they were serving as well as their own staff. But at the same time, older adults were especially suffering from sort of mental health issues, particularly social isolation, and especially for those older adults who maybe didn't have family around, didn't have a high level of technological literacy, or the technology to be able to access some of these services or reliable internet access. And we know that not all services were shifted to the online setting, but sometimes they were hybrid or there were limited in-person events. There was also one participant brought up that on phone platforms, it could be particularly difficult for individuals who had maybe some hearing issues as well. And all of that being said, some of the folks who spoke to this issue highlighted really the digital divide as well. So you can see on the right-hand side here also like their mental health, meaning our elders' mental health, because they're less capable to use a lot of technology that young people are able to use, right, during the pandemic. So their lives they suffer a lot more from depression and anxiety due to the social isolation compared to young people. So really speaking to this adjustment that many adults needed to have or weren't able to have because they had not necessarily been using technology on a daily basis in comparison to some of the younger people that were more used to using, for example, smartphones. Another individual spoke again to some of this social isolation and mentioned earlier that the church and temple is the center of our API seniors. And whenever I call my clients, they miss the service in the church, and even they cry and miss the time so badly. And I know how that impacts their mental health significantly, but if no family member, there's no way to access the religious service for them. So again, speaking to not only the digital divide, but at the same time, sort of more a social isolation for folks who may not have family to rely on or may not have technology readily accessible. Now, the third theme I mentioned was heightened racial discrimination during COVID-19. And many of our participants, when asked, described racism being common before COVID-19, but also heightened during the COVID-19 pandemic. Some of these individuals chose to share their own experiences or some of the experiences that they had heard from their own clients. And this was viewed as somewhat common. So one participant said, people have yelled at them, people spat on them. I mean, it just seems like everyone has at least one story about being spat on or yelled at. So this being somewhat of unfortunately, a common occurrence for our community. Some individuals, in addition to mentioning this interpersonal racism, also mentioned more systemic racism, particularly negatively impacting our older Asian Americans and older Native Hawaiians and Pacific Islanders. One individual said everything that impacts the community because of relative deprivation or disparities, and the systemic racist institutions that operate in our community are impacting the community worse now than ever before. So really speaking to how these gaps already existed, but continued to be built upon during the COVID-19 pandemic. Now, with these issues, community-based organizations, many of these CBOs were already addressing racial discrimination in their regular service and these service gaps. Some organizations actually increased their services to address this, and those sort of increased services included bystander intervention training, study groups to discuss ongoing events, translation and technology services, increased dissemination of COVID-19 information from a culturally and linguistically relevant perspective, and even culturally relevant meals. Now, I started to discuss sort of the fourth and fifth themes, which included resilience. And from our perspective, resilience in this case means the ability to continue operating, to continue sort of doing your daily work despite all of the challenges that the COVID-19 pandemic brought. So in this case, from an organizational resilience perspective, many participants, leaders and staff alike, really talked about strengthening their services. And we've heard, learning new skills such as technology. There were also the adapting of reorganizing staff, having more staff focused on COVID-19, even sometimes working longer hours, focusing more on creative or new ways of reaching, particularly our older Asian Americans and older Native Hawaiian and Pacific Islanders during this time in new ways. And with all of those new skills, new ways of learning and adapting, many individuals talked about actually confidence, both in learning lessons and in being able to face future crises. This is a crisis unlike anything that most folks have faced in their lifetimes. And it was really hopeful to hear the confidence in the ways in which folks discuss their organization. So one individual in particular said, I think that having done all of those things, that in the future, everyone on the staff is going to be a lot more confident that we can try new things and they can work really well and it will turn out well, and just kind of more confident that we can get through the future crises or emergencies. So really talking about how you'll continue to survive despite all of these hardships and challenges and continue to address things coming your way. We also heard this emergence of personal and community resilience, and it was quite incredible to hear from an interview perspective. We saw elders adjusting to new changes. Some participants mentioned that elders were actually quite resilient and adaptable in a way that maybe we had taken for granted before. Along with sort of staff and leaders who were often working to overcome new challenges to continue serving their clients. And there was also this idea of strength from community, of drawing together, and of hope and positivity in the face of sadness. One participant even mentioned drawing strength from their own sort of cultural and ethnic identity and ancestors. And they said, you just have to stay strong. Given everything that's happened to your ancestors, everyone else, you've got to stay strong. So I keep that in mind. So the history of what happened historically to my family and to Chinese people in general, I keep in mind that this is why you have to stay strong. So really just going back to roots in our ancestry and how much strength we each bring with our own identity. So that's from the interview perspective, everything that we covered. So I will pass it back to Dr. Jeong Lee.
Okay, thank you, KeliAnne. So far we covered the survey and interview results. So now I'm going to summarize what we have learned from the study and recommendation for CBOs that are serving older AA and NHPI audience. So first, we learned most CBOs quite immediately responded to the pandemic. So we will look into this more, but there was some differences between organizations in terms of available resources. I think it could be depending on the size of the organization or their network or, the professional relationship with other organizations, something like that. But we didn't look into that, but hopefully we could share it more later. And many of CBOs were able to offer new services based on the needs and urgency among old adults. However, we learned that some old adults had difficulties receiving services they need due to the technology as well as racial discrimination during the pandemic. The most important fact we need to praise each other for is that CBOs showed amazing resilience and flexibility during the pandemic situation. So that's what we have learned. We didn't include here, but I would like to share one side story because I think this is really important. I think some of you in this presentation received, participated in our study. So in the beginning of the study, we research team used the term AAPI, Asian American and Pacific Islander, the terminology, but many study participants requested to change the term AAPI to Asian American and Native Hawaiian Pacific Islander, more detail. So we are using right now, we are changing all of our report right now. So I just wanted to share it. Next slide. So for our recommendation, we are hoping the CBOs may reassess their existing services according to the newly emergent demands during the pandemic, so they can strategically prioritize their services in the post-COVID era. And whether or not we expected it, advanced remote technology is becoming dominant in our daily lives. So it is time for CBOs to revise or develop a more accessible way of service delivery to their clients. However, we also have to remember that quite many old adults left behind in receiving services or programs they need due to lack of technology. So CBOs should think about how to advocate the needs and issues for vulnerable, disadvantaged old adults in the post-COVID era. Lastly, anti-Asian discrimination was not new. We have it, but it became an urgent challenge among old adults. So we hope the CBOs work collectively to respond to the racial discrimination together locally, regionally, or nationally. I think we have to work together. Thank you. And now we will have a Q&A session. So Ms. Sonia Bishop is going to lead our Q&A session. So Sonia is working closely with Dr. Linda Ko as project manager, and she manages the Health Communication Research Center in the Division of Public Health Sciences in the Cancer Prevention Program at the Fred Hutchinson Cancer Research Center. So Sonia, it's your time.
As a final note, we would like to thank everyone for joining the call today and the opportunity to present the findings of this study. Next step is we will continue to integrate this data, finalize all of our analysis, and create an executive summary, which will be available to share in a few weeks. So we will also be presenting our finding, as I said before, at the American Public Health Association in October 2021 as an oral presentation. So if your organization will be there, please tap us and maybe we can see each other in person, and it'll be fun to grab some coffee. We also want to be able to contribute to the scientific knowledge base or where the community-based organizations are. I think our motivation is to be able to increase funding to community-based organizations so they can continue to serve their community. So we will be working on a scholarly manuscript for publication. And if you have any question, we're recording today's presentation and we will turn the presentation in a PDF format. And we would like to share, and we would like people to use it as needed as a resource for your organizations or other things. So we have our contact information for Jeong is there. So please feel free to contact us if you have any question that we were not able to respond today, or for any study materials and the executive summary that will be available to share in a few weeks.
Okay, thank you so much, Linda, Sonia, and KeliAnne for your presentation today. I hope everyone enjoyed our presentation. So it is very our pleasure to share, even though it was preliminary. So hopefully, we could see again. So thank you again. And